Hello everyone, welcome to Bit of Anatomy. In this tutorial, we will see the features of the intermuscular spaces of arm. So these are the spaces which are present between the scapula and the humerus bone, between various muscles extending between these two bones. So this can be better appreciated when viewed or when dissected from the posterior aspect. So the bones of interest here is scapula and the humerus. So in the scapula, the points of interest are lateral margin of the scapula, the infraglenoid tubercle, and in the humerus, it is the greater tubercle which contains upper, middle, and lower impressions. So and the surgical neck of the humerus and shaft of the humerus. So these are the bony features which are of importance. From the infraglenoid tubercle, a muscle arises, that is the long head of triceps muscle, so which extends from infraglenoid tubercle towards the arm. Next muscle arises from upper 1/3 of lateral margin of the scapula. It passes behind or posterior to the long head of triceps to reach the lower impression of greater tubercle of humerus. So this muscle which arises from the scapula, from the lateral margin and extending into the greater tubercle is nothing but teres minor muscle. So the third muscle in this region extends from lower 2/3 of the lateral margin of the scapula and it passes in front or anterior to the long head of triceps to reach the bicipital groove. So this muscle extending from lateral margin to the bicipital groove is the teres major muscle. So now with these three muscles we can appreciate three spaces here, 1, 2 and 3. So if you see the first space, so it has got 4 borders, so hence it is called as quadrangular space. So it is bounded superiorly by teres minor, medially by long head of triceps, inferiorly by teres major and laterally by the surgical neck of humerus. There are some structures passing through it, a nerve and which is accompanied by a pair of blood vessels. The nerve that is present here is the axillary nerve and the blood vessels are posterior circumflex humeral vessels. So if you see the next space, which has got 3 borders, it is a triangular space which is bounded superiorly by the teres major, medially by the long head of triceps and laterally by the shaft. So this is the triangular space or lower triangular space. A nerve and blood vessels will pass through this space. So it is one of the largest nerve in this region, the radial nerve, which passes through the triangular space and enters the spiral groove. And the blood vessels that are present here are the profunda brachii vessels. So the last space is a narrow space, again a triangular space called as upper triangular space. So this is bounded by teres minor, teres major and laterally there will be long head of triceps. So this is a very narrow space where some blood vessels will enter through this space and wind around the lateral margin of the scapula. So these are nothing but the circumflex scapular vessels. So if you see it in the dissected specimen, so this photo was taken by my students of BGS gyms, thanks to them. So what we can appreciate here is this is the dissection of the posterior part. We can see the back muscles or the scapular muscles and also the upper part of the arm in the posterior aspect. So this is the spinous process of the scapula and here is the lateral margin of the scapula. So we can identify many muscles in this region. The infraspinatus muscle below the spinous process, the deltoid muscle. So this is the teres minor muscle extending from upper part of the lateral margin and teres major muscle and one more muscle that is the long head of triceps. So this is the first space in this region. So that quadrangular space, so which is bounded by teres minor on one side, teres major on the other side, the long head of triceps and also the surgical neck of humerus. We can already see few structures there, few of the branches of the radial axillary nerve and also the posterior circumflex humeral vessels. So if you see the next space, that is the triangular space, this triangular space or the lower triangular space is bounded by shaft of humerus, long head of triceps and teres major. We can see partially the contents in this region, the radial nerve and also the profunda brachii vessels. So the third space, it is a narrow space. It appears quite large here since we have separated the teres minor and major. So it is bounded by teres minor on one side, teres major and also the long head of triceps. And we can appreciate the structures there, which are nothing but circumflex scapular vessels. So these are the intermuscular spaces of the arm and the structures passing through it. Do subscribe for future updates. Thank you.